The United Nations announced that acute malnutrition rates among Yemeni children under the age of 5 are the highest ever recorded, with more than 500,000 cases in southern districts. The following report gives more details.
Yemen's current level of hunger is extremely dangerous, causing great suffering for millions of people. Despite ongoing humanitarian assistance, 17.4 million Yemenis are food insecure. The number of people facing food insecurity is expected to reach 19 million by December 2022. According to a new IPC report, 2.2 million children in Yemen are acutely malnourished, with nearly half of them suffering from severe acute malnutrition. Yemen's already dire hunger crisis is teetering on the brink of disaster, with 17.4 million people in need of food assistance and a growing portion of the population suffering from emergency levels of hunger. In addition, the World Food Programme was forced to reduce food rations for 8 million people at the start of the year. With these cuts, households receive less than half of the WFP's standard daily minimum food baskets. Meanwhile, acute malnutrition among Yemeni children and mothers is on the rise. Hajja, Hodeidah, and Taz are among the hardest hit governorates. Children suffering from severe acute malnutrition face death if they do not receive therapeutic feeding assistance. In addition, a recent poll found that 1/3 of families have dietary gaps and rarely consume vegetables, fruit, dairy products, or meat. Malnutrition exposes children to many diseases, many of which are fatal if untreated. Diarrhea and measles may appear to be common childhood illness for many children around the world, but they can be fatal for children who are already weak in essential nutrients and who do not have timely access to health care. Many of the malnourished-related health complications that are treated could be avoided if basic services at the primary healthcare level were provided. Yemen is suffering from one of the world's worst food crises. Parents are unable to bring their children to treatment facilities as they cannot afford paying for their treatment. Yemen's disastrous economic slide in recent years, as well as rising hunger levels, have been widely blamed on conflict, with the Yemeni rial's depreciation pushing food prices to their highest levels since 2015. Furthermore, there are significant funding gaps in the humanitarian response for Yemen's 20.7 million people in need of assistance, such as clean water, health care, food, and nutrition. The international community and donors must immediately increase their efforts to combat widespread hunger and malnutrition, or people in Yemen will continue to